Dr. Steve Knighton here from Nottinghill Family Wellness Centre. Today we're going to go over the treatment we do for low back pain, especially SI joint pain. So if you have pain on this side into your hip, it's most like your SI joint. At the clinic, once you get the SI joint diagnostic, we're going to start with an IFC machine. So it's electric stim. They go on with suction cups. We're going to put a heat pack over that for about 8 to 10 minutes. It helps loosen up the muscle, and it actually feels pretty good on most people. After that, we're going to go into a thing called Shockwave. It's a pneumatic gun. There's a bullet in a tube that hits back and forth. We're basically going to find the areas of pain and we're going to work that over a bit. So we're going to come in like this and just hit in the area of the glutes for the pain. We can come here in the glute med, the glute min, sometimes gets right against the edge of the joint. Other people, they find they wrap it quite around their hip. We're going to beat that up pretty good. Anywhere from 1,000 to 1,500 hits. The intensity control is basically on the patient. After that, we're going to come in and do pretty much some just trigger point release stuff in the patient's glutes. This is one of the worst things I do in here, especially if it's really bad. I can get some good force. We're going to find the areas of pain. Sometimes it's in the glute min here. Other times it's in the glute med. We're going to dig that out really good before the adjustment, get everything loose, and then we're going to show you the adjustment after that. So start with the IFC and some heat, then go to the Shockwave to loosen stuff up. Some somewhat ART, somewhat trigger point therapy in there to loosen it up. And that's all to prepare the low back for the adjustment, which we're going to show you in a minute. Okay, so the final piece of the puzzle to fixing the low back pain, especially SI joint, is the SI joint adjustment. We're going to come with the patient on the side, bring her down here, a little bump, and just get her back to explode through there to get everything to move. If something moves that well, even on their first visit, they will notice a difference immediately when they stand up off the table.